News from public health officials today as Nevada tries to tackle the opioid crisis. Several hundred stakeholders meeting today at the Tuscany Hotel and Casino for the state's second opioid response summit. Politics Now co-host Patrick Walker explains the very latest trends.
The big headline here, overdose deaths are going down, but fentanyl is becoming more of an issue. For the past decade, an average of more than 400 Nevadans a year died after overdosing on opioids. But it's getting better. After a myriad of changes on a number of fronts, that rate dropped to 356 last year. Fentanyl is becoming more prevalent, however. 77% of overdoses include more than one drug.
Now what we're seeing is it blended with opioid drugs, fentanyl drugs, generally speaking.
While methamphetamine continues to be the #1 deadly street drug, prescription drugs, including opioids, were the most common causes of death among accidental overdoses. Over an 18-month period from January of 2017 to June of 2018, 384 people died from accidental overdoses of various substances. Prescription drugs accounted for nearly 2/3 of them. Since then, officials say opioid prescriptions are down from 88 per 100 people, among the highest in the country, to 55 per 100 people, something they call, quote, unprecedented.
What we have seen is that the providers have really carried the water on this and have altered the way that they've been prescribing.
The state continues to focus on prescription drugs. Attorney General Aaron Ford filed suit against more than 40 manufacturers, distributors, executives, and pharmacies.
We're actively serving these defendants, and we anticipate in short order their case getting going full steam ahead.
The crackdown has had some unintended consequences, though. Legitimate pain patients have had a tough time filling prescriptions. State officials say they are seeing some progress addressing that.
We are hopeful that some of the clarifications that were done this session will help ease some of the burden for implementation.
This summit follows one in 2016 by then-Governor Brian Sandoval. It led to several changes in state law the following year. This one could lead to changes as well in the upcoming session in 2021. I'm Patrick Walker, 8 News Now.
56 first responder agencies now carry naloxone, which is used to reverse the effects of opioids in the event of an overdose. And since 2016, state officials say naloxone has been successful in saving 277 people.